code the ICD-10 more specifically for the encounter, and I've updated the problem list with that additional detail so I have that in the future. And notice the HCC indicator turns teal. That's the indication to me that I've already coded this one in the calendar year. If I see the patient again later in the year, I'll see that this one's already been coded. I'm already getting my RAF credit for it. So it can help me focus, zero in on the HCCs that have not been coded yet this calendar year. Primary thrombocytopenia, no additional specificity, one click, I've got it on my visit. And diabetes. So diabetes unspecified, as Steve was talking about earlier, E11.9, maybe back in the ICD-9 days it would have gotten you through, but here in ICD-10, there are literally over 1,000 diabetes codes. So we need to get the right code because this can have a big impact on reimbursement. The detail that ICD-10 requires for diabetes, again, we're going to ask targeted questions to get that detail. The type, the insulin use. Now, before I answer the next question, the complication status, notice the subsequent question is complication detail, which has details about that complication. As I answer this first question, let's say it's kidney complications, notice that the complication details filter down to just those details that are relevant for renal manifestations. If I specify CKD, now I still need to get the staging, so I indicate that it's stage 4. I don't have to answer the question about the stage 3 subtype. And now I can code that diabetes for the encounter, and I get not only the diabetic code, which is better now, E11.22, but also the CKD code, also the insulin code. So previously, what I would have had coded for this patient, I would have coded the diabetes, but probably E11.9, lower RAF score. I wouldn't have coded the CKD. I probably wouldn't have seen the CHF, probably wouldn't have seen the thrombocytopenia, and I might have coded that acute MI and invited an audit. So I've gone from a 0.166 RAF before with just coding the diabetes to almost 10x, a 1.49 RAF with these HCCs. So this can have a huge impact on risk adjustment, better visibility to the HCCs, and better coding of those HCCs for the encounter. So don't just take it from me demoing, but we have some real world examples of the impact that this can have on our health system clients. One example, Concord Hospital in New Hampshire. We partnered with them to study the impact of that same solution when they went live with it in the middle of 2023. They recognized that poor HCC identification and non-specific coding was having a big impact on their RAF scores when they looked across at their peers. So in late June of 2023, they made that application that I was just demoing the default problem list and coding workflow for all of their primary care providers.